Hello again. This is Dr. Pamela Noel on why the current stethoscope of the problems that I have seen with the stethoscope that hospitals must have or provide stethoscope covers, which, as I've mentioned in previous videos, that it is a CDC recommendation that we protect our stethoscopes, whether we cover them versus cleaning them with alcohol between patients, which we in studies in reality that doesn't happen. Right, most providers are not cleaning their stethoscopes in between patients, and so it's the same problem we've had with washing hands, and that's why gloves were invented. And so studies have found a myriad of organisms on the stethoscopes of healthcare providers, doctors, nurses, students who are their patients. And so stethoscope covers are on the market, but most hospitals do not utilize them. And so there has been times, or many times, actually, I should say, when I walk into a patient's room who's on isolation and there's actually no isolation stethoscope in that room. And so you're having to use your own stethoscope anyway. And so a lot of providers, they just use their stethoscope as normal and then go on to the next patient. Or we might use either a glove to cover the stethoscope diaphragm, or use something like this, which is the bag that the isolation gown comes in. So I've seen that also. So I'm going to use this as a is another tool. I guess some people use, which happens quite often actually. So I'm just going to demonstrate exactly what that looks like. For those of you who don't work in hospitals, it's easier to understand when you can actually see it happen in real life. So when you walk into a patient's room, just imagine I'm wearing a gown. And so you're going in, just pretend I have a gown on with my gloves. You're going to examine the patient. Now you're touching a patient that has an infection that required for them to be in isolation. And then, like most providers, just move on to the next patient. And then whatever infection they might have had now has contaminated the stethoscope. And then you're moving on to the next patient. Every provider, every nurse, student is doing the same thing throughout. So just imagine what that looks like. And so what some of us do, me included, I would usually use a glove. Sometimes you can use the bag that the isolation gown came in, and you just kind of slip your stethoscope into the bag and then examine the patient. That way your stethoscope is not touching the patient directly, right? So if the patient has MRSA, C. diff, COVID, or whatever other infection, your stethoscope is somewhat protected from touching the patient. The problem with this method is the fact that not only is your stethoscope touching the patient, even if it is covered, stethoscope at some point. Right? So you're going to the tubing to pull the cover off your stethoscope, right? So those are the same hands that just touched the patient, and now you're touching the tubing. So although the diaphragm piece is covered, now you're touching the tubing to take the cover off your stethoscope. And also, you're not going to walk around with your stethoscope in your ears the entire time, right? So as soon as you finish examining the patient, we naturally want to get this out of our ears. It's not very comfortable after some time, right? So to take off from the cover, you have to touch your tubing to pull it off, and you're going to take down your stethoscope from inside of your ears and put it around your neck this way or that way. So you're touching the stethoscope again to do that, right? So no one's going to take off their gown while the stethoscope is still in your ears, right? Wash your hands, then take off the bag and take this out of your ears. That won't happen. That's just not feasible, right? So most people are going to take this out of their ears, take that off of the stethoscope, and you're touching your stethoscope the entire time. And most people don't that we have with the current stethoscopes that are in the market. The isolation stethoscope came in to cover this part,